Tonight, a report from the 8 on Your Side team. Atrial fibrillation is one of the most common abnormal heart rhythms. It can lead to some life-threatening conditions.
Tonight, medical reporter Susan Shapiro takes you into a cardiac lab at York Hospital where doctors are using a newly approved treatment.
Doug Burns has suffered from atrial fibrillation for 10 years.
It's just kind of unnerving that your heart's just not beating smooth.
Atrial fibrillation affects about 3 million Americans. It's when the upper chambers of the heart, here and here, quiver instead of beat. That can cause a blood clot to form in the heart.
It can increase a person's risk for congestive heart failure or weakening of the heart muscle, which is a serious problem. And it can also increase a person's risk for having a stroke.
Here we see the evidence of the abnormal electrical activity.
Heart rhythm specialist Safwat Gassis is now doing a new procedure at York Hospital to correct AFib. Balloon cryoablation uses a freezing technique that destroys the tissue that causes the abnormal electrical activity in the heart. A catheter is placed in a vein in the groin area and advanced to the upper chambers of the heart.
And we're going to place the catheters in that area, and we're going to map the arrhythmia and the veins, and then take it from there. Good. Go ahead and inflate the balloon, please.
Nitrous oxide, a coolant gas, is then released inside a balloon about the size of a quarter through the catheter.
The balloon is around the vein in a very circumferential way, and go ahead and ablate.
It freezes to minus 112 degrees Fahrenheit, destroying the electrical connection between the heart and the pulmonary vein. The pulmonary vein drains blood from the lungs back to the heart. It often carries the abnormal electrical activity that causes AFib.
So we're done with ablations for this vein, and we're going to move on to the next vein.
Dr. Gassis will repeat the process on 3 more pulmonary veins. He says this freezing technique is easier, faster, and safer than the traditional method. That uses radio frequency to generate heat to destroy the tissue.
Because you're using freezing energy, it's got less chance of damaging the pulmonary veins, less chance of damaging the esophagus, which is the food pipe, and it lies right behind the heart.
Doug Burns underwent balloon cryoablation in January.
I've been in normal rhythm ever since, and that is a strange sensation to wake up in the morning. It's like, oh, I feel pretty good. I'm just not in fib anymore.
Perfect seal. Go ahead and flush it.
Susan Shapiro, On Your Side, News 8.
Now, doctors at York Hospital have now performed about 30 of the balloon procedures. Dr. Gassis says so far 85% of the patients have responded favorably, and no one has had any acute complications.